Hello, my name's Adam. I'm a healthcare assistant on the emergency floor at Worthing. I'm going to introduce you and teach you how to use PatientTrack. So the first things first is you're going to get your patient up on the screen like this, and this little button here will be the one that you'll need to use to input the observation. So when you've clicked that button, this next box will come up. We've hidden it for patient confidentiality at the moment, but you'll have the patient's name, the bed number, or the patient's hospital number, and whereabouts they are in the hospital. You'll press the confirm button. So this is the next box that will come up after press confirm. So you'll enter your temperature. So my patient's temperature is 36.7. So 7, and her blood pressure, lying blood pressure is 135/45. The standing blood pressure, obviously if you're doing a lying and standing, that's where we input that underneath on that one. So her heart rate was 92, her respiration rate was 18, and her AVPU, so is she alert, does she have new confusion, verbal, is she responding to verbal conversation, is she responding to pain, or is she unresponsive? So my patient is alert. Her oxygen saturations are 97, and then we've got lots of options on this one. So this is for the oxygen level, so you've got room air, Venturi masks, nasal cannulas, non-rebreathe bags, humidified oxygen, and NIV and Optiflow. So luckily my patient's on room air. And then when she's moving about in the bed or in the chair, is she in any pain? And she's not. So you'll do that and then press submit. So this person's new score is a 1. So you can see her temperature, her blood pressure, her heart rate is what's scoring her a 1 because she's above a 90. And then all the rest of the observations here. So yeah, she's got a new score of 1. So you'll press close and acknowledge, and that's your observations done. So we have these charts on the ward that is now informing me. So my patient's scoring a 1, so her observations will be a minimum of 4 to 6 hours. So I must inform a trained nurse who will come and see the patient. They will consider changing the frequency of the ovation, and they will speak to the nurse or the doctor if you're concerned about the patient at all. So it's 6 o'clock now, and I'm redoing my patient's obs. She's back in bed, but now she just looks, doesn't look as good, and I've redone her observations, and her temperature's come up a bit, so 37.4, and her blood pressure's dropped to 105/53. Her heart rate's risen to 98, and her rest rate's also gone up to 24. She's still alert in the bed, and her oxygen saturations are 95. She's still on her room air, and she's got a little bit of pain now. So once we put these observations in, so now I've redone her observations, and she's now got a new score of 5. So she's scoring a 2 for her rest rate. Her heart rate's still 98, so that's a 1. Her blood pressure's dropped, so that's scoring a 1. And her oxygen saturation is below 96, so that's also scoring a 1. So with this now, so she's scoring a 5. So she's 5 or 3 on one parameter, so she'll be on hourly observations now. I need to inform the trained nurse or the medical team immediately. And she'll be assessed by the team on the ward. If there's no improvement within 30 minutes, then she'll be escalated to more senior doctors or outreach